Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot. We're going to be going over pediatrics, and to be more specific, we're going to be covering the school-age child, the adolescent, the child with cognitive issues, and the hospitalized child. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it, so go ahead and give it a thumbs up now. Subscribe to my channel if you haven't done so already. And don't forget, I'm now offering next generation NCLEX review sessions and one-on-one tutoring sessions. You can reserve your spot by going to my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my other social media platforms, such as TikTok, Instagram, and Facebook. My handle is the same everywhere, Nexus Nursing. So without any further ado, guys, let's get started. Cognitive disorders, hospitalized child, school-age child, and adolescent. First question. Word cloud. What would you suspect this patient's diagnosis to be? Look at that cute little face. What do you suspect that diagnosis to be? Go ahead, type it in, guys. What do you think is happening? If you weren't able to get into the Kahoot, you can just go ahead, type it on the live. What do you think the patient's diagnosis is? Fifth disease. Erythema infectiosum, fifth disease. So look at, if you saw that little baby's cheek, look at that baby had like that slap face appearance, right? That's fifth disease. And so this can be transmitted by like respiratory secretions or blood. So for this type of patient, you would expect like analgesics to be ordered for the pain, anti-inflammatory drugs, and of course, antipyretics for the fever. Next question. Select all that apply. Therapeutic techniques to manage nighttime enuresis includes what? Select all that applies. How do we treat select all that applies as true or false? So therapeutic techniques to manage nighttime enuresis. Eliminate fluids after dinner. Avoid carbonated drinks after 4 p.m. Drink sugar-containing beverages after 4 p.m. Avoid highly salted foods. Interrupt the sleep to void. Use punishment as an avoidance technique. I'm sorry, I spelled sleep wrong, but you know what I meant. So which techniques are therapeutic to manage nighttime enuresis, nighttime bedwetting? Okay, so let's talk about it. Eliminate fluids after dinner. Yes. If the child's drinking all of this fluid at nighttime, what do you think is going to happen? They're going to have to urinate. So we're going to eliminate fluids after dinner, right? Next, avoid caffeinated drinks after 4 p.m. Why? Caffeinated drinks are bladder irritants. It irritates the bladder. The patient's going to want to urinate, and they act as diuretic, right? So that's true. Look at the next one. Drink sugar-containing beverages after 4 p.m. No, we want to limit sugar-containing beverages after 4 p.m. because that sugar that's in the beverage is also going to irritate the bladder and make the patient want to urinate more. So we're not going to choose that. Next, avoid highly salted foods. Yes. Why? What does salt attract? Fluids. Where salt goes, fluid goes, right? The patient's going to be thirsty. They're going to want to drink. They're going to want to urinate. We don't want them urinating at night. So that's good. We want them to avoid highly salted foods. Next, interrupt sleep to void. Yes. You wake that child up in the middle of the night so they can get up and void, and then you bring them back to bed. You're going to interrupt sleep to void to limit or eliminate nighttime enuresis. And last, using punishment as an avoidance technique. 2 people chose that. No, guys. Using punishment is never a let me not say never because that would be a lie. I'm not even going to say that. But when it comes to enuresis, punishment is not a therapeutic technique. Select all that applies. Which are not clinical manifestations of a patient with Down syndrome? Select all that apply. Here are the choices. Pronounced nasal bridge, small ears, protruding tongue, hypertonia, hyperthyroidism, impaired immune function, which are not clinical manifestations of the patient with Down syndrome. If you don't want to type the whole thing out, guys, you can just put the color on the live. That's fine. Okay, so let's talk about it. Look what I did. Impaired. The question said, which are not clinical manifestations? And I checked off the clinical manifestations. I'm sorry, guys. Don't kill me. Don't kill me. I was backwards on this one, so it's going to mess with the numbers. But let's talk about the clinical manifestations, which is what I have checked off. The clinical manifestations or signs and symptoms of the patient with Down syndrome, you're going to see them with small ears, protruding tongue, and they're going to have an impaired immune system. They're going to be at risk for infection, right? And I was not supposed to check any of these because the question said, which is not clinical manifestation of Down syndrome. So I'm going to tell you what the answer should have been. It should have been pronounced nasal bridge. Pronounced nasal bridge is not a clinical manifestation of Down syndrome because a patient with Down syndrome, they're going to have a flat nasal bridge. It's not going to be large. It's not going to be pronounced. It's going to be flat. Another answer which should have been checked is hypertonia, because hypertonia is not a clinical manifestation of Down syndrome. The patient that has Down syndrome, they're going to have the opposite. They're going to have hypotonia. Those muscles are going to be lax. The muscle is not going to be toned, especially the respiratory muscles. And that's why that patient's going to be at high risk for respiratory infections, upper respiratory infections. And the last one, which I should have checked, I didn't, is hyperthyroidism. Why? Because hyperthyroidism is not a clinical manifestation of Down syndrome. If anything, guess what is a clinical manifestation of Down syndrome? The opposite, hypothyroidism. Everything slows down. Brain function slows down, so we see the patient may have cognitive deficiencies. Heart rate slows down, patient may have bradycardia. Blood pressure goes down, patient may have hypotension. Even the GI tract slows down, right? Patients at risk for what? Constipation. Okay. So I'm sorry, this slide is going to mess with the numbers. Please forgive me. All right, word cloud. According to Tanner's stage of development, in which stage are breast buds noted? Type in your answer. According to Tanner's stage of development, in which stage are breast buds noted? Don't be shy, guys. Okay, so the correct answer is 2. And this is a famous test question, so you guys have to know this. In stage 2, you'll see elevation of the breast tissue and you'll see the areola gets larger in diameter, okay? Word cloud. According to Tanner's stage of development, in which stage is enlargement of the scrotum and testes noted? According to Tanner's stage of development, in which stage is enlargement of the scrotum and testes noted? This is another famous test question as well. You guys need to know it. Two guys. Also two. So for the males, you will see also reddening of the scrotal skin. That's important to know. Word cloud. According to Erickson, the school-age child should accomplish a sense of industry, or they will feel a sense of what? According to Erickson, the school-age child should accomplish a sense of industry, or they will suffer a sense of what? Industry versus what? Inferiority. Yes. This is the stage where acknowledgement and praise is so important to them. They want to do a good job. They want to succeed. That's why the school-age child, they love stickers and ribbons and, first prize, because that accolade that they've accomplished something. And if they don't get that, then they feel a sense of inferiority. Something's wrong with me. Everybody else is great, but I'm not. At 11 or 12, the meningococcal vaccine should be given. At what age should the booster dose be administered? Is it 15, 16, 17, or 18? So at 11 or 12, we know that the meningococcal vaccine, I spelled vaccine wrong, forgive me, should be given. At what age should that booster dose be administered? 15, 16, 17, or 18? Okay, guys, the correct answer is at 16. So the child's going to get it at 11 or 12, preferably 11, but 11 or 12, and then they'll get the booster at 16 years of age. What is the agent that causes scarlet fever? Is it Bordetella pertussis? Is it enterovirus? Is it rubella virus? Or is it group A hemolytic streptococci? Or strep, as I say, because you guys know I can't pronounce anything. Correct pink locks in college, they can get meningitis, yes. Very good. Group A hemolytic strep. So with the group A hemolytic strep, guys, the patient can have like a red swollen pharynx. They can have the strawberry tongue. That patient's going to have to be on antibiotics for a full 24 hours before they can go back to school. And speaking of antibiotics for a full 24 hours, after they've been on antibiotics for 24 hours, they're going to do what? Switch out their toothbrush, right? Because we don't want them to reinfect themselves. Now, let's look at the wrong answer choices. Bordetella pertussis, that would be for whooping cough. Enterovirus, that would be for poliomyelitis. And then rubella virus, that would be for German measles. Okay? True or false? Separation anxiety in the hospitalized child is an abnormal occurrence. Is this true or is this false? Separation anxiety in the hospitalized child is an abnormal occurrence. Very good. Everyone got that right. That's false. This is very, very common. Speaking of separation anxiety, which is not a stage of separation anxiety? Would you say anger, protest, despair, or detachment? Which is not a stage of separation anxiety? You guys need to know the stages, by the way. Anger, protest, despair, detachment. Oh, wow. Only 4 people chose the correct answer. Anger, that is not a stage of separation anxiety. Protest, despair, and detachment is. So here's what happens. The first stage is protest. And in the protest stage, the patient's angry. They do not want mommy, daddy, their caregiver, their loved ones to leave. So they are angry. They will kick, they will scream, they will bite, they will pinch, they will act a fool. They do not want that person to leave. So they are protesting, right? And then they move to the second stage, which is despair. Mommy's left or daddy's left or whoever it is. Now they're in despair. It's extreme sadness. No toy will make them happy. They don't want to hug anyone. They don't want to play with anyone. They're just very extremely sad. And then they move on to the third stage, which is detachment. And they detach to protect themselves. What do? So they realized, okay, mommy, daddy, whoever was left, and I'm very upset, but I can't be like this forever. So you know what? I'll make a new friend. Now all of a sudden they love the nurse, or they love this toy that has been placed in front of them. But this new person or toy that they quote unquote love is very superficial. They really want their parent or that loved one there, but because they're not there and they have to protect themselves emotionally, okay, they'll detach from that loved one and they'll have a superficial attachment to, a toy, another child who's there that they'll play with, or even the caregiver for the moment, which is a nurse. Okay. Select all that applies. What are the warning signs of suicide in the adolescent patient? The warning signs of suicide in the adolescent patient. Select all that apply. Having a history of depression, using alcohol or drugs, giving away cherished possessions, talking of their own death, or desire to not desire to diet. I meant desire to die. I don't know what I was doing. Desire to die. Describing self as worthless. Sudden cheerfulness following a deep depression. Go ahead, choose your answers. Which do you think are warning signs or symptoms that this patient is suicidal or thinking about suicide? Okay, so all of them. Someone on the live said everything but yellow. Guess what? This answer in yellow, this is one of the most famous signs. One of the most famous signs of suicide in the adolescent, right? They have a favorite piece of jewelry or a favorite book or favorite something that they don't go anywhere without. And all of a sudden, they're giving it away to their best friend or someone that they really care about. Why do you think they're doing that? They're doing that because they know they're not going to be on the earth soon. And so they want to leave their loved ones something to remember them by. Okay. So that patient having a history of depression, use of alcohol or drugs, giving away cherished possessions, famous sign. Them talking about their own death or their desire to die, them talking about being worthless, or sudden cheerfulness following a deep depression. If this patient was deeply depressed, now all of a sudden, overnight, they're happy. You think that depression just suddenly lifted? Of course not. The reason that they're suddenly cheerful is they figured out a way to commit this act and follow through. So they feel like there's that act that they're about to commit is their light at the end of the tunnel. The suffering's going to be over soon. That's what they're cheerful about. Okay. Let's talk about describing self as worthless. I tell my students this all the time. If you're in psych or you're going to be taking psych soon, I want you to think about depression in this way. What I'm about to say to you, it's going to make your life a lot easier answering these questions. All depression is anger, hostility, and resentment turned towards self. I'm not worthy. I'm not a loser. Once that patient slowly starts to come out of the depression, maybe they're taking SSRIs, maybe they're on a TCA, whatever, the patient's coming out of that depression. this is a famous test question. One of the best ways you can tell that patient's truly coming out of the depression, they start seeing value in themselves, because a depressed patient does not see any value in themselves. That's why they have no problem trying to commit suicide, because they see their lives as worthless. But as they start to come out of this depression, they start seeing value in themselves. Okay? All right, last question. What is the life expectancy or prognosis for a patient with Down syndrome? Would it be 30 to 40 years, 40 to 50 years, 50 to 60 years, or 60 plus? What do you think the life expectancy or prognosis is for a patient with Down syndrome? Only 3 people chose the correct answer. 60 years or beyond. That is their life expectancy, 60 years and beyond. You guys did a great job for hanging in there with me. Let's see how you did.